Welcome back. Along with the excitement that comes with high school graduations, there's of course preparation for the transition for college, and that means being more prepared is more than just roommates and meal plans. Another thing that parents might want to consider adding to their to-do list is vaccination against meningitis B. My guest today is Dr. Len Friedland, Vice President, Director of Scientific Affairs and Public Health Vaccines at North America GSK, and Jamie Schanbaum, GSK Spokesperson and meningitis survivor. She's also a para-athlete. Welcome to both of you.
Yes, thank you, Audrey.
Yes, good morning.
Let me start with you, Dr. Friedland. What is meningitis?
We're talking about a disease that's caused by a bacteria. The bacteria's name is Neisseria meningitidis. For short, we'll call it meningitis. This is an uncommon disease that can be potentially devastating. 1 in 10 people will die from this illness, and in those who survive, 1 in 5 will be left with lifelong complications such as blindness or deafness or loss of limbs. There are 5 different types of this bacteria that cause disease, and we now have vaccines, 2 different types of vaccines to protect against these 5 types of bacteria.
What are the symptoms?
Right. This disease starts very, what we'd say, non-specific. People may think they have the flu or the cold, or they're just not feeling well.
Irritable.
Yes. Irritable, weak. Maybe if somebody was studying all night, they pulled an all-nighter, they may think, I'm tired for that, or perhaps they were out all night and they feel they're hungover or something like this, right? Very non-specific. And adolescents and young adults think they're invincible. And so they're not going to run to the doctor when they start with a little bit of nausea, vomiting, or the beginning of a headache, or maybe even a low-grade fever, or feeling weak. But it comes on very, very rapidly, and Jamie will tell you that by 14 hours she knew something was really wrong and she ended up going to the hospital. 14 hours for an adolescent is remarkable to present for medical care, so something really has to be going wrong for that to happen. And when, by the time we get to that end of that first day, the average time actually to prevent to a medical doctor with Neisseria meningitis is 19 hours. By the time that time comes, which is pretty rapid, 19 hours, this when people are fighting for their lives. Jamie will tell you her story, but she was fighting for her life at 14 hours into this illness. And that's why we have 10% of people will die and 1 in 5 will be left with lifelong complications. And so therefore, well, of course we have things to treat this illness. Jamie was treated. What we'd really want to do is prevent it from the beginning, to start with. And we do that with 2 different types of vaccines today that are recommended for use in our adolescents and young adults.
So, Jamie, you thought that maybe you just had the flu? Your symptoms were that non-specific?
Yes, my symptoms were very unclear. I was just not doing well. Took a nap, and then the next morning I was almost incapable of walking. There's a little bit more detail into that. Basically, I was vomiting. I was going to the bathroom every 2 seconds, and my steps were getting smaller and weaker. I could barely hold myself up. I was eventually crawling on the ground and really cold. And I definitely knew that this was different. And so I went to the hospital in fetal position, shivering, and there was a nurse there that guessed that I had meningitis. And so we went from there. We did dialysis and then a ventilator quite quickly. Within the next couple of weeks, I saw my limbs go from red rash to purple to black to dead. Like, my shoulders were fine, but my fingers were what do you call it? Just shriveled like raisins, and my feet were bending like ballerinas could not fathom. They were just pointed out and curled. It just didn't look good, and we were just trying to fight off the wounds that I had, and then we pushed back our amputations as long as we could because of the treatment that I had. I did hyperbaric treatments anyways. But I got out. It was very difficult emotionally, specifically, because it was hard. I mean, I was from this cute young girl, totally like living it, new college life, to a stigma, and that was something I wasn't really used to or ready for. The stairs, my inability to get up stairs itself and not getting in people's way. I mean, it was difficult, but when anyone goes through a new, like let's say they break their leg, I mean, people compensate. Humans are insanely adaptive. So I don't have fingers, and simple things like picking up a credit card on the ground can be difficult. But I automatically think, oh, pick up a piece of paper that I already have, slide it under there, and I grab it. Just different things. Like, people are just insanely adaptive. Even though it was very difficult at first, I definitely have been able to go on and live my life completely independent. Like, my best friends really don't consider me to be disabled. I mean, I kind of don't, but I'll definitely use a handicap pass whenever I can.
At least you have a sense of humor, Jamie.
I do. But life has been wonderful. I mean, from the hospital, wondering what my life could be like, to what it is now, it's much more than I ever could have imagined. So it's been a good opportunity, and I'm happy to be here with Len and also GSK and talking on their behalf, because I was like any other person going to school. I didn't know anything about meningitis, and I also thought I don't need to do anything to live my life. And to live your life, you need to take care of yourself. And so call your doctor. Make sure you get these 2 different vaccines that help prevent against the 5 groups of meningitis, because you don't want to go through what I went through. Let me tell you. I took one for the team. You don't have to do it. So go out and please go get educated at least.
Well, doctor, how do you get meningitis?
It's a good question.
You essentially get it because you live on the planet Earth. We're all at risk because this disease is spread from person to person. It lives in our nose and in our throat, and occasionally and unpredictably it can get into our bloodstream. Why that happens, it's really unpredictable. Why it happened to Jamie, it just did. Almost always it doesn't happen, but occasionally it does. The focus is on adolescent young adults because of that's where people tend to be more around other people. So as this bacteria is spread from person to person, it's spread even more so in that age group, and occasionally it can get passed into the bloodstream. Why it happens? It just did. It's uncommon, no question about it, but uncommon things happen to real people. This disease, by the way, occurs all across the United States. If we look at a map of where the cases are, it's essentially where people live. There are more cases where population density is a bit higher, but it occurs in every state of our nation. And it's the adolescents and young adults where the Centers for Disease Control puts its focus for prevention, because that's the group that has the most crowding. At meningitis.com, that's a website, meningitis.com, meningitis.com, meningitis.com. You can learn more about the disease and the 2 different types of vaccines that can help provide protection. And you can also learn about people like Jamie, because there's nothing like a picture to tell a story, right? And so, yes, this is uncommon, no question about it. But there are a lot of things that are uncommon for which we give ourselves the benefit of protection and prevention. For example, we wear seatbelts when we get in a car, even though our risk of getting in a car accident is really very, very low, right? And so think of vaccination as essentially like a seatbelt. It's there in case we ever need it. And that's what this is about with meningitis. 2 different types of vaccines to help provide protection against an illness that can be extremely devastating. And Jamie is such a hero, because she's telling her story to let people know and put a face to a name of something that is otherwise it can't happen to me.
Yeah, we just want people to take advantage of what's available. So be proactive and talk to your doctor.
Well, I would encourage everyone to check with their doctor. Now, I know that there are some people who believe in vaccines and some people who don't, but I got to tell you, meningitis could be a life or death situation. Thank you, Dr. Len Friedland and Jamie Schanbaum.
Thank you, Audrey.